Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, today we are going to discuss a very small topic, that is actinomycosis. And what is the phenomena, the histological phenomena which I'll be highlighting is the Splendore Hoeppli phenomenon. So, let's start with what it means. So basically this actinomycosis is what? It's a rare suppurative granulomatous infectious disease, and it is caused by your anaerobic gram-positive filamentous bacteria. So now normal flora also we can get this organism, actinomycosis. This infection can be normally seen in your oral cavity, gastrointestinal tract and female genital tract, especially with a history of intrauterine contraceptive devices, that is IUCD. Clinically, how the patient will present to you will come to you with abscess formation, tissue fibrosis, sinus drainage if a abscess or tract is formed, and occasionally a soft tissue mass also can be produced or formed mimicking a tumor. So causative organism is your actinomycosis. Actinomyces israeli, that is a bacteria, and it is treated with high dose of penicillin. And this is what we'll be stressing upon. This is Splendore Hoeppli phenomena. It is a characteristic histological feature which we see on histology if we get this organism. So what is the basic thing you have to see in the histology? So they form, actually these bacteria, they form sulfur granules, which are your small yellow granules which are found within the abscess as by infection here, by actinomyces infection. So what is this Splendor Hoeppli phenomena? It is basically, I'll show you the diagram also. There what you will see is there is a pink rim at the periphery of the colony. Why it is formed, that pink rim, why it is formed, that is basically your immunoglobulin and cell debris which is getting accumulated there. So this is what you saw. You will see the pink rim of periphery, pink rim at the periphery will notice this immunoglobulin because of immunoglobulin and the cell debris. And why this is formed? Because of your by the fungal, bacterial or parasite infection which is producing this immunological reaction at the periphery, and that is some kind of a cell debris which is getting accumulated there. So and this has very high prevalence in your low socioeconomic status, in areas with low socioeconomic status. And as I said you, in patient with intrauterine devices, this has increased incidence of actinomycosis. In fact, when you see the pap smear of female with intrauterine contraceptive devices, then also you will notice this kind of actinomycosis clusters. That in cytology, it appears as a cotton ball appearance. Cotton ball, just like you'll see dark cotton ball patchy. So where you see these kind of things, actinomycosis, two infection with a low socioeconomic status, then IUCD patients, cervicofacial, this post-dental infection you can see, then post-traumatic injury creating an anaerobic environment, there you can see, post-intrauterine device placement, any kind of post-surgery like ruptured appendix or bowel perforation. Then in smokers with poor dental hygiene, aspiration of infective material. So in these cases you can see it. And what you see that I told you, because of reaction in the periphery, you will see lymphocyte, neutrophils, giant cells, fibroblast. And the bacterial colony, that is the sulfur granules, which is found at the center, that is basically composed of your basophilic radiating filaments. So now just see. So this is a text section from your tonsil, right? So we are seeing the stratified squamous epithelium. So here you are seeing the stratified squamous epithelium. This is what? This is our area of interest. These are actinomycosis. So one ball you are seeing here, one is here, the big one, and the small one here. So in periphery you can see that is a radiating type of architecture is there. So these are basically filamentous organisms. And in between you have your sulfur granules, and then this is the periphery where the immunological reaction and the cell debris are getting accumulated. So this is the special stain GMS that we have done. So here you see so beautifully this architecture has taken up the stain here and in the small ones. So here this see dark periphery, rim of periphery, the immunological reaction that is we highlighted here. These all are your stratified squamous epithelium, not area of interest. So another section area where we notice the same actinomycosis. This is a ball you can say. This structure is your Splendore Hoeppli phenomena. So again, the Splendore Hoeppli. See, this is the filamentous thing Radiating basophilic filaments, you can see basophilic is a dark stain which is taking on the GMS. So this is gram stain. So gram stain is giving you so beautiful picture of your filamentous, basophilic filamentous bacterial thing, and center you can see the sulfur granule. So these are very easy to identify in any section. So but your eye, that we know that we see what our mind knows. So that is why we have to be thorough with how this organism looks like and where you have to keep an eye. It's very easily identifiable in smears and as well as in your sections, so histological sections. Somewhere it can be as like a commensal, normal flora also you can have it, but somewhere it can be a positive agent for your infection. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Have a great day.